The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system, to sustain the elimination of mother-to-child transmission. And most importantly, that the elimination and achieving certification is the right of every child to born and remain free of HIV and syphilis.
We had started with the program of elimination from about the year 2000, between 2000 and 2004, when it really strengthened. We have been able to strengthen the capacity in our laboratory services. That has also helped us for early detection, more awareness, and early treatment, of course.
As soon as a woman goes to the general clinic, a pregnancy test is done, and she's automatically booked into the prenatal clinic so that we get them as early as possible in the first trimester. And that has been another change that we have seen, where the amount of pregnant ladies joining the clinic in the first trimester has increased to about 90%.
The medication used requires no out-of-pocket payment by patients. That is also a very critical part of ensuring that we continue to provide these medications free of cost.
So Stephanie came in today, and we did first a group talk with the other pregnant women that came in, and the health education that includes HIV, all the lab tests, including the HIV. And we also go more in detail with the HIV and syphilis testing that they will be getting today and why it is important for them to get it.
It's important for me to have the syphilis and HIV tests because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
They feel free to come into the clinic, especially those who already know their status. We give her a lot of support. They come to the clinic, they have a seat, they go through the process just like any regular client.
One of the lessons learned is that this can only be achieved, the elimination of mother-to-child transmission of HIV and syphilis can only be achieved when there is strong teamwork and quality healthcare services being provided.
The science says it's possible. It's the healthcare worker and the family that needs to make it happen. And so we are proud that we made it happen. And we are proud and committed to continue the efforts.
Well, in my opinion, it's very, very important that we eliminate mother-to-child transmission so that that neonate, that baby can grow up living a healthy life.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Yeah, achieving the elimination feels very good. It's proud as a country. I would like to express, overjoyed. We feel really privileged to have worked so hard and being recognized.
It's an awesome feeling. We've worked hard at this, years of hard work and dedication.
I was overwhelmed with joy and happiness. And mostly because it means that we really help these families to have at the end, a child that is free of HIV and syphilis.
It is also a big achievement for the country because it shows how with a team effort, with the partnership between the Ministry of Health and PAHO, that we can achieve these elimination goals. And so nothing is impossible.